Hello, my name is Henry Silverman, and I'd like to give a short presentation on informed consent. Well, what is consent? Well, consent is defined as permission or approval to participate in a research study. Informed consent is a process. The goal is to provide sufficient information so that a participant can make an informed decision about whether or not to enroll in the study or to continue participation. It's an ongoing process, and the participant always has a right to withdraw or opt out. Of the four ethical principles in research, informed consent is based on the principle of respect for persons. Informed consent is the fundamental mechanism to ensure respect for persons. It's a deontological principle, and it also allows individuals to decide for themselves self-determining lives. And in that respect, it's a utilitarian principle. Now, there are several elements or items of information of informed consent. There are so-called essential elements, and then there are additional elements. This slide shows the basic elements of informed consent. One has to give the purpose of the research. One has to define the risks, the benefits, the alternatives to participation in the study. One has to make assurances of confidentiality of participant medical information. One also has to give information about any compensation for research injury. One has to emphasize that participation is voluntary and free. And then finally, one has to give contact information, information regarding who to contact if they have questions about the research, who to contact if they suffer research injury, and also who to contact if they have questions about their rights. This slide shows a checklist for these basic elements of informed consent, which investigators and members of research ethics committees should use to make sure that all these elements are in the informed consent form. And this slide shows the additional elements of informed consent. So what makes up a valid consent? It consists of several elements. One, there has to be adequate disclosure of information. And then with this information, the individual has to have decision-making capacity, which means that they have to understand the information, they have to comprehend the information and appreciate how this information concerns them, and then they have to be able to express a choice. And then finally, the individual has to make a voluntary choice. There are several challenges for disclosure of information. One, sometimes the amount of information could get quite long, leading to very long consent forms. Also, there could be issues about translation, complexity of the informed consent form, and that's why the recommendation is that the consent form should be at the 7th grade level. And then one has to be concerned about the setting for informed consent form. One should avoid obtaining informed consent in the hallways or in busy emergency rooms. One has to respect privacy of the individual and be concerned about the setting of obtaining informed consent. As mentioned before, informed consent is a process, so you need to give the participant time for questions that should be answered. You should give them time to discuss the informed consent with family and friends, and also time to review and discuss any questions about the informed consent document. One has to be concerned with the voluntariness of a person's choice to participate in a research study. Participants should be able to make a free choice without any coercion or undue influence. Well, what should the Research Ethics Committee or the Institutional Review Board look for? Well, they should be concerned with the cognitive capacity of the potential individuals, and they should be concerned with individuals or groups of individuals who may be vulnerable. Vulnerable being defined as persons who cannot protect their own interests. If an individual lacks decision-making capacity or competence to make a decision, then one has to obtain permission or consent from a proxy or a surrogate. One needs to be concerned about different types of vulnerable populations. This includes children, prisoners, pregnant women and fetuses, the cognitively impaired, those who are financially impaired, and those who are terminally ill are just a few of the types of vulnerable persons. Regarding children, the research has to present no greater than minimal risk to the child, and if it does present greater than minimal risk to the child, then there should be offsetting benefits to the child. One also needs to obtain permission of the child's parents or guardians, and if appropriate, obtain the assent of the child. Well, what are some of the challenges of consent in the Arab region? Well, one, most researchers are not used to taking a valid consent form in clinical treatment, and also most patients are not used to signing consent forms for medical treatment. There may also be cultural issues that the investigators and members of research ethics committees must be aware of. One, a lot of patients give deference to authority, and hence they may not be able to ask questions from the investigator. Two, proxy consent may come from tribal leaders and husbands. There may also be a reluctance to use documents that require signatures, and hence there's a lack of acceptance of signatures. And patients don't expect their doctors to express uncertainty of a treatment in clinical research. Also, translation can be difficult if the person translating information has not had specialized training in research. And then finally, individual autonomy is a Western concept that is not accepted in all areas. For example, in rural areas where you have tribal leaders, and hence the question, who gives consent for research studies? Is it tribal leaders who give permission, or are individuals able to give individual informed consent? Let's watch this short video from the movie Constant Gardener showing the effects of poverty on informed consent. So some take-home messages. Informed consent is a fundamental ethical application of respecting the autonomy of persons. A valid informed consent should ensure adequate disclosure, understanding, cognitive capacity, and voluntariness. Informed consent should be simple and should. Thank you very much.